Greetings. I wish to speak of James A. Morris, Jr., MD, FACP, upon the occasion of his withdrawal from the active practice of medicine after more than 4 decades. These few words are not intended to insult or make fun of this man, though one would be inclined to do so since he so often made fun of others. Rather, this testimony was to honor and praise this man, his career, and his achievements in his profession. James A. Morris, Jr., MD, known by his many patients and his small circle of friends as Jim, as well as other less pleasant names, shall in this talk hereafter be referred to by that name so affectionately used by his longtime staff, Dr. Morris. In reflecting on the medical career of Dr. Morris, one must start with the now legendary and iconic internal medicine practice of Silver, Nansteel, and Morris. And one must ask, what distinguished Dr. Morris and made him so special to so many? Unlike the brilliantly incisive and quickly decisive Dr. Silver and the 9 to 5 it's just a job approach of Dr. Nansteel, Dr. Morris offered something different. In addition to sound clinical skills, Dr. Morris offered and provided something more important and more treasured: humanity, concern, and compassion. He listened, he thought, he cared for the patient, and let the patient know he cared. For Dr. Morris, medicine was more than a job and more than a business opportunity. It was a skill, an art, and a service to others. Combining his medical knowledge, clinical skills, intellectual curiosity, and his gracious natural friendliness, Dr. Morris provided patients with a rare blend of communication, compassion, confidence, and hope. His demeanor was unfailingly respectful. His message and method of delivery were careful and caring. Patients knew that he cared. Patients were left with confidence, a confidence that their doctor knew and worried about their condition, and hope, a hope that this doctor might actually be right. These qualities should come as no surprise. The strong, ethical, moral, and humane principles of Dr. Morris reflect his background from a large family and his pre-medical education at a local high school, at a training center for dedicated men, and the great mainline Augustinian University. Moreover, Dr. Morris learned to be a doctor at the Temple University School of Medicine in the days before the physician's first instinct was to get lab work, conduct a study, and order a scan. One of the famous doctors at that institution, whose book was entitled The Art of Diagnosis, taught the fundamental skill of looking, listening, and letting the patient declare the diagnosis. So for Dr. Morris, the practice of medicine was an art dependent not just upon studies, blood work, and reports, but with a paramount emphasis upon the history, the appearance, and his own physical examination. His professional challenge was to explore, research, and to think outside the box for the patient. And his personal satisfaction was to answer that difficult question and to guide the patient and family throughout the experience. Of course, the practitioner could also be seen experiencing some small joy from drawing blood, as befits his former experience as a phlebotomist, as well as some undeniable glee at a patient reaction to a particularly penetrating digital examination. Medicine has been serious for Dr. Morris, and patients and colleagues have come to know this. Nowhere was this more evident than when Dr. Morris was on call. After enjoying a bracing after-dinner drink or perhaps a second helping of dessert, a call would come in for Dr. Morris. Instead of casually asking, "What's up?" or "How can I help?" Dr. Morris would uniformly reply by authoritatively and commandingly pronouncing, "Dr. Morris." By these words and tone, he would instantly transform himself into the super serious medical man. The call, the problem, and the patient were not to be taken lightly. and his practice has not been limited to the formal patients, but has often reached out in a most compassionate way to elderly relatives or friends. He has been a serious, caring doctor, willing to help shoulder the burden of loved ones. But alas, his own shoulder has not fared so well, succumbing to the exuberance of his physical exploits. And so, like so many of his patients, Dr. Morris has been a surgical patient, a rehabilitation survivor, and one who had to endure extended periods of a physical disability. Yet this repeated experience neither diminished his zeal for the continued practice, nor his abiding interest in patients and the medical arts. As Dr. Morris draws near the end of his notable career, he should take pride in his fame and achievements. For his fame is not measured by notoriety in professional journals, popular publications, news, or social media. No, for Dr. Morris, fame is the stellar reputation he has earned over the decades among professional colleagues, patients, friends, and his community. All who know Dr. Morris respect and admire him. Thus, the achievement of Dr. Morris is not marked by plaques, honors, or awards, but in the health, wellness, and quality of life experienced by so many under his care. In conclusion, it's fitting to give voice to a collective and universal sentiment. Dr. James A. Morris, Jr., on behalf of a generation of grateful patients, both those now present and those who have gone before us, we honor you, we salute you, and we thank you. Good luck and Godspeed.